One common nursing school concept for pulmonary system may be VQ ratios. So V means ventilation. So that means it's the actual movement of the air. And then we have Q, which is perfusion, which is the actual circulation of blood and oxygen to the lungs. So when we have a low VQ, that means simply that we have a low ventilation and efficient perfusion. And then when we have high VQ, that means the ventilation is good, and then we have low perfusion. So a common pulmonary condition tested on is emphysema, for example. So emphysema, you have lots of air going into the lungs and actually being trapped, but the perfusion is poorer compared to the amount of air going into the lungs. So you have a high VQ ratio. And when we think low VQ, which means there's deficient ventilation, think of asthma because there's narrowed airways and increased secretions, which is preventing the movement of air going into the lungs. And then lastly, we have something called dead space, which means there is both a deficiency in ventilation and